Hi, Dr. Sean Caesar here. I'm a naturopathic doctor with a focus on alternative cancer treatments here in Winnipeg. I wanted to tell you about a case that we just got in yesterday. She's a patient with colorectal cancer, stage 4, so it's metastasized and moved elsewhere, who has gone through chemo quite a while ago and suffered side effects. So she decided to quit the chemotherapy after 3 rounds and go with naturopathic medicine. Now, what we were able to achieve with just using naturopathic medicine alone was what's called no evidence of disease, which some people consider a cure. It's not exactly a cure until we're 5 years out, but with her results, it's quite spectacular that it's able to achieve that with stage 4 cancer, colorectal cancer, with natural medicines alone. So I'd like to tell you a little bit about that, as well as the chemotherapy and what to expect, as well as with the natural therapies, what you can expect with that, and also a follow-up with just a summary and how you can contact us at the very end. So now I'd like to go into a little bit of detail about her case. She's 37 years old. She's had the metastasis from her colorectal cancer, and it's involved her what's called the omentum, which is basically the casings around the intestines, as well as her lungs. And so this kind of cancer, the stage 4 cancer, has been determined that it's incurable or that it can't be fixed, that she'll live with cancer for as long as she's around. However, I always like to leave an opportunity for patients to open the door and say, there's a possibility we can get what's called no evidence of disease. Yesterday, when her report came in, that's exactly what it showed. So no evidence of disease basically means that there's a CT scan, head to toe, that says, or just to the abdomen or to the lungs, it says, okay, we can't find any cancer any longer. The chemotherapy that she had was called FOLFOX. Now, FOLFOX is a combination of 3 elements in there. There is 2 chemotherapies and 1 B vitamin complex that's involved in that as well. The 2 chemos are 5-fluorouracil, and also with FOLFOX, it's oxaliplatin, which is the other one. And she was suffering side effects that she didn't want to continue because they were life-threatening, and that was with the clotting that she had experienced. So clotting anywhere from lungs to anywhere else can be life-threatening. As well, she suffered from coldness and tingling in the hands of the fingers, which is called neuropathy. And severe fatigue as well. So her energy level was 4 out of 10 when she came in. 37 years old, very young, and she wanted to get her quality of life back, as well as reduce the cancer, and as best as she could using the naturopathic medicines, and that's why she came in. The chemotherapy that's used, the 5-fluorouracil, also has an impact on the gut, and also you're often given 2 drugs more as a side effect to the nausea and the vomiting and the diarrhea that you can experience during the chemotherapy treatment. So it's a heavy hitter. Chemotherapy hits tumors and cancer by turning them off. However, it also hits any cell in the body that turns over rapidly, including the lining of the intestine. So she suffered from diarrhea and nausea through this as well. And these are common side effects experienced by at least half the folks that go through it, if not more, with the oxaliplatin, the 5-fluorouracil, as well as the FOLFIRI combination that's used for any of the colorectal cancer treatments. The next section, what I'd like to talk about is the actual naturopathic treatments that we've done and go through their effects and how they can enhance the immune system, how they can benefit patients, as well as how they continue to have their impact even after treatment is finished. So I'd like to continue with the discussion about this patient and take you into the Oncotherm room, where we discuss a little bit about the naturopathic approach that we used for her to get the results that we did. So welcome to the Oncotherm room. This is where we do most of our treatments with our cancer patients, and that we can do IV medicines at the same time as we do our Oncotherm hyperthermia. The Oncotherm hyperthermia is one of the premier natural medicines, and it's not on most people's minds when you talk about natural medicine. But let me go into a little bit of detail about each of the treatments that was used for this particular patient with the stage 4 colorectal cancer and the effects of each one of them. So we combine things together to make as strong an effect on the cancer as we can. And that includes things like IV vitamin C, which lots of people have heard of, IV DCA, IV ALA. These are IV medicines that are put directly into the system so that they have the highest dose possible. You can't take oral IV vitamin C to have an action against cancer at all. So we also used mistletoe for her therapy, as well as supplementation, specific supplementation. We have our own formulas here, and each cancer has a different treatment protocol. It's not like you can treat all the cancers the same. And so each of our cancers and each of our patients, even ones with colorectal cancer, don't get the same exact treatment. And it's tailored to what we find. So one of the things that we do use is this it's a machine from Germany, and it is an Oncotherm hyperthermia machine. It's a $300,000 purchase that we made to bring people to our clinic to have, so that they don't have to travel all the way to Europe in order to get these. For instance, in Germany, they've got about 300 of these machines. It's used in standard cancer care in hospitals there. And it's often covered by their healthcare system, as well as mistletoe. So here in North America, it's very, very different. We've got the idea that there's alternative medicine, which is this, and then there's chemotherapy, surgery, and radiation, which is the standard treatment. However, it's much more engaged and much more together because the doctors in Germany have the training. So with this device, what happens is the patient comes in, we hook them up to the IVs, and they lie down with this placed over wherever the tumors may be. If it's in the lung, we place them over the chest. If it's in the abdomen, we place it over the abdomen. And anything between the upper probe and the bottom of the bed, which is a water bed, it's basically kind of like going back to the 70s, is where we get the action. We have like a radio frequency, goes top to bottom. So it's not heating. You can't sit in front of your heater and fight cancer. It's just impossible. This uses what's called a radio frequency that heats up a tumor that can be deep in the body, and heats it to a fever temperature. Fever temperatures, the tumors do not do well in. And the proteins on the surface break down, alerts the immune system, and suddenly you've got the whole body fighting the cancer, reducing the tumor volume, hitting the stop buttons for cancer turnover and growth. At the same time, we're delivering IV medicine. So for instance, IV vitamin C, which has the effect of an anti-cancer action, which is very unique to vitamin C. Vitamin C produces in the system the hydrogen peroxide that's in the tumor environment. Tumors do not do well with hydrogen peroxide that's produced there. You can't give this as hydrogen peroxide. Some people ask me, can I take that as a food supplement? No, you can't, because it needs to be introduced as a high-dose vitamin C, which gives the ability to hit the cancer with hydrogen peroxide that knocks it down. We also, for her, we used what's called mistletoe. So mistletoe is European mistletoe. I always joke that people come off here with the inclination to kiss everybody, and that's the North American mistletoe. The European mistletoe is actually a medicine. And so this medicine we use for our cancer patients to enhance their immune system and actually to induce what's called apoptosis or apoptosis. And that is cancer cell die-off, which it can do directly. And that's combined with the vitamin C, so you don't have to do all these therapies separate. You can do them as one when it's combined in IVs. The other medicines, the DCA and the ALA, have nice other actions on cancer. You need to hit cancer from several different angles. You can't just attack it from one angle, because cancer will always find a way around things. So it'll become resistant to treatment, which is what happens very often with chemotherapy. Suddenly you've got a growth where before you had a reduction. So now what we want to do is we want to hit the cancer from different angles. Our other IVs that we use for this particular patient is DCA and ALA. ALA also had a very good action for her in that it not only stopped cancer, it has a particular off button that it hits, but it also helps to improve the symptoms of her hands and feet and the neuropathy that she suffered. The vitamin C has the side benefit of helping with her energy. So her energy increased from 4 out of 10 to 9 out of 10. She had her energy back again. So she was very excited about that. The DCA has the ability to turn over cancer cells so that they produce more normal cells. There's a little component called mitochondria in cells. It normalizes mitochondria. So you've got 1, 2, 3, 4, 5 different kinds of actions to create an anti-cancer effect with the medicines that we are using. And that effect for her gave such a great result in that her final CT that we got just in yesterday, after doing it for 3 months on chemotherapy, we still found that there was evidence of disease. She wasn't there yet with her latest, which she just used the naturopathic medicine for. We were able to get that result. I'll talk a little bit next about her overall case and what to expect from the oncology side, as well as the follow-up with her and what we're doing moving ahead. What I'm going to tell you next is a little bit about what you'd hear from the oncology side of it. That's the cancer care here in Manitoba, who use the radiation and the chemotherapy and also the surgery as their main tools, and what they feel about the alternative cancer treatments, as well as we'll go forth with just talking a little bit about how you can contact us if you need to. So I'd like to tell you a little bit about the oncology side of things, which is your everyone who handles your cancer in the medical field, including the folks who give you the chemotherapy, those who handle radiation, and those who handle the surgeries as well, and why they feel their particular way they do about alternative cancer treatments. And it comes as a question lots of my patients will ask me, whether it's online or whether it's in person, is how will my oncologist respond to using these therapies? Unfortunately, I would love to have a teamwork where we all work together. Everybody knows what's going on as far as treatments go. However, the problem is the training for oncologists doesn't include the natural medicines. In Germany, if patients go to see the oncologist there, they also have these things in mind, using the Oncotherm hyperthermia, as well as some IV therapies, and mistletoe are part of their standard cancer care. But the training for medical doctors and for oncologists here in North America is that there is no training in natural medicines, and the natural medicines are seen almost solely as an interference with especially chemotherapy and very often radiation. There's a handful of chemotherapy docs that do have the openness to what we do as far as the alternative cancer treatments. However, they're very few and far between. So the resistance is very, very, very common. In fact, patients are encouraged not to follow this, and for not good reason, because there's lots of forwarding that I'll do of information and studies to the oncologist to say, there's a number of studies, take a look at these. And unfortunately, they're very often not even looked at. So the benefits are that the natural medicines do enhance chemotherapy, radiation, and surgery, and can be used as a sole treatment if it's necessary, and patients are getting the side effects from their chemotherapy and can't continue with that. This is a viable, very strong option for patients such as that. So a quick summary on what we heard in the dialogue was the introduction to the patient, how she was progressing on her chemotherapy and also getting side effects from her chemotherapy, as in the clotting and these kinds of things. The plan that we went ahead with using naturopathic medicine, as well as the chemotherapy and what it does to the system as far as side effects go, and how we were able to overcome those with using the natural therapies, including the Oncotherm hyperthermia, the IV therapies, the mistletoe supplements, and the diet that we had put together as a protocol for her. And an emphasis on that it's not something that you can research online and say, okay, I'm going to take this for my cancer and I'm going to take that for my cancer. It really needs the guidance of someone who has the training as naturopathic doctors do, 7 years of their naturopathic medicine training, as well as a specialty, not specialty, but focus in on cancer treatments and seeing hundreds of patients, thousands of cancer patients, different stages, and also different approaches that we can get these kinds of results. So if you have any more questions, please contact us below. All the information's provided, and you can ask whatever question you need or call if you'd like to come in to see myself or any of our cancer team here.